I got a smile out of it.
Hi.
How was the first visit? Oh, she's already saying hi to you guys.
Yeah.
First time, just a brief story, correct me if I'm wrong, but husband found me on YouTube. What's his name?
Charlie.
Hi. Charlie. She's here. Anyways, you had your first visit. What was it like?
Wonderful. Amazing. He does everything that the videos show. I walked out feeling amazing and able to move and bend without a pinch and without that shocking nerve pain. So I'm back today for more.
Well, you ended up, and correct me if I'm wrong, I thought I listened to you about you had tried another chiropractor, don't mention that name, but you had gone on Groupon. I'm not a big advocate of getting people on Groupon. I mean, did I sign you up for any long-term care?
No.
If today's the last visit, it's the last visit. She can come back when she wants.
Yeah.
And that's truly it. I gave you a recommendation, but...
Yes, and the other chiropractor was wonderful at the time, too.
Absolutely.
But... yes, I felt this time, rather than doing the Groupon, I would actually go to somebody that was knowledgeable about the situation and really cared about my pain rather than just the sale.
And you felt the difference.
Definitely.
Let's do some more.
Yeah,
Charlie, this one's for you.
Okay.
So as a chiropractor, I'm not a big advocate of flip-flops because you don't have support in for the feet and the shoes that affects your back and spine. Can you wear them? Yeah, they're easy to get in and out of, but they stress the body. Wear them, they're comfortable, but I'm a big advocate for lace-up shoes and rotating your shoes around. That will help your back as well. So there's a tip for the day, especially if you guys work out there on your feet a lot. Have two good pair of shoes, two good pair of tennies or tennis shoes that you wear can help your back because you allow them, when you rotate them around every other day, it kind of freshens up the shoe and it feels a little better on your back and feet. So first of all, her right leg is shorter on this side, right ankle turns in slightly, so there's stress that's going on. And we could feel, so the spinal cords, or what they call the thalamic tracts, or the tracts that run down the cord, communicate to muscles in the body. So this is, why do we go and check the legs? Well, that's one way. So the brain, especially areas of the cortex, the cerebellum, and the tracts, or the midbrain, come down and they talk to muscles, and the nerves that come out talk to the muscles that pull on tissues, pull on the muscles in that. So I'm feeling for stress and tension, and we're losing our flips already right here. And I could feel it as I'm trying to turn the heel outward. So that's an indication of stress that's going on right through this area here on her SI. It was your SI joint, right? So when I'm looking at things, I let their body show me where I need to go, and that's why you notice that some of the things change, that I'm not always adjusting the same thing in the same way. So we're going to adjust the right SI joint, or what's called the sacroiliac joint. Good. Better movement here. We'll bring the legs up, flex them, good. I want you to raise this leg without bending the knee. All the way up for me. Back down, try the other one. Back down. Did they feel about the same, or was the left one a little more difficult?
The left one right here.
You could feel it on the opposite side? So one of the things that I'm doing, I'm looking where the sacrum, that triangle bone here, is rotated. So I want you to cross this ankle over this one. We're going to adjust the sacrum. And I want you to lay on this hip, face me this way. Good. Bend right here. Good job. And can I share your big win?
Sure.
She's lost a great amount of weight, and take the win, because you're getting your health back, aren't you?
Yes. Yes.
So that's one of the ways that you stay out of my office, is carry less on your body.
Working on it.
And you're doing it. It's a lifelong process. Face down.
All right.
All right, now we're going to check the motion of that joint. About 40% of the time, when you guys are experiencing back pain, It's usually SI joint problem, or at least one of the first ones. So that's what I see. Raise your left leg for me, see if that feels better.
Oh, worlds better. Wow. Doesn't pinch.
Let's see if I can get a little more motion on this area. I want you to lay on this side, face me.
Okay.
Did you follow some of the home care instructions I gave?
Yes.
Yeah, at least. Good.
Epsom salt bath.
Good.
Nice soaking.
Tip number 1. Number 2 was? Cold
Water.
pack. Water, okay, good.
Yeah, I didn't do the cold pack. That felt really good.
I hope the video got that. Charlie, did you get that?
Oh, that was the biggest, deepest pop. Perfect.
Face down. Good job.
Oh.
So just scanning to see where the areas of restriction are. Take a deep breath in. Release it out. Let it out. Let it out. Good. Good. On your back. And then I'm going to have you actually bend your knees, feet on the table. That'll take tension out of the mid-back. We're going to cross the arms. No problems with the shoulders? Okay. Going right to the upper dorsal here area, which is your mid-back, right by the ribs. Breath in, blow out.
Oh.
Feet down for me. Good. And we're going to check the hip, knee, ankle. So this is the short leg side. Felt the hip and the knee adjust. Now we're going to align the ankle. Bring off. Good. Doing okay?
Uh-huh. Oh, wow.
You like Jello?
Uh-huh. Jelly.
Good.
I feel like, what is that, Snap, Crackle, Pop cereal?
Rice Krispies?
Yeah.
Let's have you sit and face the camera for me. Good. So one of the things, well, I forgot to do this with her, but I help patients understand that moving from one position to another is really important, and usually what I have people do is roll to their side and teach them how to actually sit up correctly. So it's almost considered a very modified type burpee. Not what you're thinking of in that, but it helps people, 1, save their back, 2, save the adjustment, and 3, helps them be aware of their posture and their body more. So nice arch into the lower back, shoulders slightly back, and we help correct some of the areas. Sometimes chiropractors do it where they're standing, seated, adjusting while moving. This helps change some of the posture. All right, deep breath in through your nose, out through your mouth. And right at the atlas there, good.
It affects your vision.
Say again.
It affects your vision.
You felt it?
Well, when you do the head, your
yeah.
eyes, you start seeing double.
Only one of me though.
Yeah.
That's where you get the Warwick technique.
There you go.
All right.
In all fairness, you did tell me yesterday to roll to the sides and sit up. So
Yeah,
you
but
did tell me. But I didn't even think about it just now.
all habits take, you have to do something 8 times to make it a habit. when people want to lose weight or exercise, minimum 21 days, 21 to 30 days is the magical point where it becomes more of a habit. So I'm constantly doing this, exercise, eating, doing, journaling, whatever it is, it becomes habit. The other thing that's tip number 2 for the day is if you guys sit a lot, notice how she's sitting. When you put your tush into the seat or your rear end in the chair, you can sit back, but if you want to help work on your core, sit at the last 50% of that. So yep, if she sits up like that, she's going to engage her core muscles more in her spine, sit up more erect and forward. So you can do the same thing when you're at your desk. Any parting words or final words for people?
Definitely come here. Awesome.
It was awesome.
Yeah.
I wish I could get my own adjustment. I'm Dr. Warwick at Warwick Chiropractic and Massage. Thank you, Warwick, for watching. And Charlie, thank you for sharing as well.
Thank you. Bye.
Bye.